Fertility preservation benefits patients who may be going into treatments that could potentially damage their ovarian function. Patients who have cancer, who are about to start a chemotherapy regimen that could damage their ovaries, or patients who are about to have surgery that could damage their ovaries, should think about fertility preservation. There are many ways to preserve fertility. The gold standard at this point is to do embryo freezing. This is best for a couple who would like to create embryos and who would like to use them at a later time to achieve pregnancy. Other methods of fertility preservation include egg freezing. This can be used without sperm and involves a similar method of retrieving eggs as with embryo freezing, but the eggs are not fertilized before they are frozen. Embryo freezing is a technique that has been developed over many years and has been around for many years, and the technique to freeze embryos is well worked out, and the pregnancy rate continues to improve with each new development. Egg freezing, on the other hand, is something that has been developed more recently. It is still mostly done under research situations and requires that fertilization be done with a technique called ICSI. The difference between embryo freezing and egg freezing is that embryo freezing is a technique that has been in practice for many years. It is used every day in IVF programs, and it continues to improve with each new development. Egg freezing, or oocyte cryopreservation, is something that has been developed more recently. It is still done mostly under experimental procedures and does not have the same success rates as embryo freezing. Fertility preservation is important because the eggs that are in a woman's ovaries are very delicate. The most number of eggs that a woman has is actually present at the time of their birth. Over time and over their lifetime, the number of eggs in the ovaries decreases with each year. If a woman has cancer or any other disease that requires chemotherapy that could potentially damage the ovaries, what happens is that this decline in the number of eggs increases, and the number of eggs that the woman has decreases much more rapidly. Fertility preservation can be used to harvest the remaining eggs before chemotherapy and hold them until the woman is ready to use them at a later date. Fertility preservation is also important for men who are in a situation where their sperm function or production may be compromised, or they may have to have one or both testicles removed. Fertility preservation is fairly simple for men. It requires the deposit of sperm into a bank, and the sperm is frozen for use later. Sperm that is frozen can be used for any number of fertility treatments afterwards. The most effective way to use frozen sperm when there is a limited quantity of it is to do in vitro fertilization with injection of the sperm into the egg for fertilization. With this method, we only require a very small number of sperm to achieve pregnancy per cycle.